Bismillahirrahmanirrahim. We are looking at the serology of hepatitis B. In the viral hepatitis, especially hepatitis A, B, C, D, E. So the serology of hepatitis B somehow looks tricky, but after this short tutorial, you will become easier to attempt any question related to the serology of hepatitis B. So first of all, you should be able to appreciate the three antigen and three antibodies associated with the hepatitis B virus. So mnemonic is a second or SEC. So these are three actually antigen. So we are coming back. First of all, what is antigen? Antigen actually it's coming from the virus, so which attack the immunity. Okay, so in response to that, the human body the immunity activate and they form the antibodies. So the antigen are present in in the viral structure, and the antibodies are produced by the human, which provide immunity. So what are the three main antigen? Okay, so this is size of actually the HBV. Okay, so this is the nucleus, or you can say the DNA, which is partially double stranded DNA. Here is DNA polymerase. So the number one antigen is the surface antigen. Okay, HBS antigen, and against this the antibody will be the anti-HBs. Okay, so first is the second surface antigen. Okay, the second one is the between the capsid and this envelope. So this is the E antigen, HBE antigen. So the antibody against it will be the anti-HBE antibodies. Okay, so SE. The last one is C, that is the capsid or core antigen. Okay, so HBC antigen, the antibody by the human will be the anti-HBC antibodies. So core antigen, core antibody. So second, I mean the antigen HBS, HBE, HBC. Okay, so this the anti HBC is either IgM or which is in the acute infection. You know better. First of all, the our immunity start with the IgM, then later become IgG. So in the chronic infection, so you will see the IgG, while in the acute infection you will find the IgM. So these are, and this is actually these are anti-HBC, both IgM and the IgG. Okay, so three antigen, three antibodies. So we have HBS, anti-HBC, and HBE. So first of all, look at what do you mean by HBS? What it represent? Just remember S for sick. So when there is HBS is positive, mean there is infection, either acute or chronic. Okay. So if the antibodies against the HBS are present, mean anti-sick, mean the patient is immune. Okay. So it's immune either due to vaccination or due to host infection. Okay, so he's not sick. Okay, so HBS means sick, and anti HBS anti sick means it's not a sick. Okay, and then the anti HBC. I have not mentioned HBC antigen because it's not detectable. So you need to look at the anti HBC. It's either IgM or IgG. IgM in the acute, IgG in the chronic. So the anti-HBC actually show IgM and the IgG. Okay. So C represent for mnemonic. You should remember continue or had come. In continue, if the infection is continued, or had come in this infection has had come in the past. So either it's acute or chronic or past infection when there is anti-HBC is positive. Okay. So it's if IgM it's acute, if it's IgG it's chronic. So anti-HBC is past infection, or the patient is undergone the recovery phase. Okay. So this is HBS, HBC, and the last one is the HBE. For mnemonic, easy transmission means they show the easy replication. So high infectivity when they are highly transmitted, so are they are easily replicating. So E represent when HBE is positive, mean there is high infectivity. Okay, when anti-HBE means it's not easy transmission, so infectivity will be low. Okay, so HBS sick or anti-sick. Mean antibodies actually show the immunity, and the antigen show the infection, or the mean you're attacking the immunity. Okay, so C continue or head come infection, and the chronic acute or chronic or post infection, while E represent the transmission or replication, easy or not easy. If anti it's not easy, mean low infectivity. If it's easy, mean high infectivity. Okay, so these are actually the antigen and antibodies. So let's look at how they are represented in this sketch. So on this titer, and a month after exposure, what happened to these the antigen and antibodies. So we are looking in the incubation period in the acute infection, where the HPV DNA, which is against the DNA, is also detectable in the acute infection. Okay, and we are looking at the recovery, what happened to these antigen and antibodies. So first of all, what is happening? This is normal and negative. You can say the titer, and here is the HBS. So first of all, what is represented HBS? So in this period, in this incubation period, in the after some time, so the HBS is looking positive. Okay, so in the incubation period, only HBS is positive. Okay, and HBE come in the acute infection. Okay, so first of all HBS, then HBE, then this anti-HBC, which is the IgM before 6 months. So here is 6 months, and after 6 months, the IgG will be represented. Okay, so before 6 months it's acute. After that, either it's going to recover or going to become chronic. Okay, so if you look at here, this is what this is, and now anti-HBA. So first of all, the antigen represented, then the antigen go down, the antibodies goes up. So HB is coming up, coming down, then the antibodies coming up, and here it is. Okay, so what this is anti-HBS. So this period, if you look at here, here is HBS come down, but the anti-HBS takes time to rise again. So this period where there is HBS is low, this is known as window period. Okay, so where you only detect either anti-HBE or the IgM or IgG, mean anti-HBC. So HB is, you can see the level is low. So the more important one is the anti-HBC. Okay, once again, so HBS first represented in the acute infection, then HBE, then the anti-HBC. So this is in the acute infection. After that, they both go down, and the patients start to recover. So recovery, the anti-HBC is again positive, IgG you know better, and the anti-HBS are positive, and anti-HB. So these show the immunity in the recovery. Every antibodies are present. Okay, while in the infection phase, HBS and HBE are positive. Okay, so if you look at the chronic infection, what will happen in the chronic infection? This HBS not come down; it's continue. Their level is high, so it's positive in the chronic phase. Okay, so if you look at here, so this is HBS, so it's positive in the chronic phase. Mean patient is not recovering. Okay, and this is what HBE. Okay, and this is anti-HBC IgM in the before 6 months, after 6 months IgG. Okay, so this HBE, you can see what is happening to HBE. Anti-HBE are the positive in the later phase of the chronic infection. In the early phase, it's a HBE. Okay. So that was all about the concept. So let's look at this mnemonic to pick up the MCQs easily. Okay, so mnemonic is same score. S represent the HBS, A represent acute, M represent IgM, and E represent HBE. Okay, so in the acute infection, you will see the HBS is positive, IgM is positive, HBE is positive. Okay, and you know better when the infection become chronic, IgM become IgG. Okay, so in the chronic phase, you will see the S is positive, M is positive, E is positive, and the IgM replaced by IgG. In the acute, you will see the same. Same is the mnemonic. So in the A, mean these SME are positive. Okay. So you know better HBS as represents sick. So if anti-HBS is present, mean patient is not sick. It mean he is immune, or you can say that he is vaccinated. So if only anti-HBS is positive, mean patient is vaccinated. Okay. Okay, so and the same me, which they represent me, which show the window period, which I have already described you. So this was the window period where HBS level was low. Only IgM and HBE are for the me. That is the mnemonic here. Okay. So me mean M. If you rotate the M, it's become W. So mean window period. Me show them. So in the window period, what you will see? You will see the IgM is positive and NTHB is positive. Okay. What about the recovery phase? Recovery phase, remember the score S. I mean, in the recovery, you will every antibody you will see the anti-HBS, anti-HBC R represent the recovery phase, E represent the anti-HBE. So SCRE R represent recovery, and these SCE represent the your antibodies. Okay, so in the MCQ, in the especially in the USMLE or in the step one exam of LM, so they use the term recovery, the past infection, immune due to natural infection. These three terms are same. So recovery or past infection or immune due to natural infection. So the serology will be same in this case. Okay. So, as I mentioned, the antigens show the attack immunity, antibodies and describe the provide immunity. So, if all the tests are negative, mean what? There's no exposure to virus and there is no immunity. Mean there he is not vaccinated. He has not yet he has not yet exposed to virus and he has not the immunity at this time, so the patient is susceptible. Okay, so this is acute same, so this is a mnemonic same for acute and IgG in the chronic phase. If the anti-sick mean a vaccine and for the score, so recovery and window me IgM and anti-HBE. So you can pick up the a lot of MCQs through this mnemonic. Okay, if you look at the clinical approach, how will you will approach the clinically? So first of all, you should ask either infection is present or not. So how you can check at HBS? If HBS is positive, mean there is infection. If HBS is negative, mean there is not sick. As for sick, okay, so not infection. So positive, you have to ask two questions: acute or chronic, high or low. How you can check out acute or chronic? Of course, by the IgM. If IgM is positive, mean it's acute infection. If IgG is positive, mean it's a chronic infection. High or low, you know better by HB, easy transmission, E. High, if HBE is positive, mean it's a high infectivity. If anti-HBE is positive, mean it's a low infectivity, not easy, anti-easy. Okay, so low infectivity. So same for acute, you know better. This is mnemonic and HBS and M and E. Okay. So and what about the HBS negative side? Mean either patient is susceptible or immune. How you can differentiate by looking at the anti-HBS. If anti-HBS is positive, mean he is vaccinated or he is immune either by the recovery or by the vaccine. Okay, if this anti-HBS is also negative, mean all the tests are negative, the patient is susceptible. Okay, so the person is susceptible. And what about the how you can differentiate vaccine and the natural? So look at the anti-HBC. If it's positive, meaning he has natural immunity through the past infection. While in the vaccine, it's negative. Only anti-HBS is positive, anti-sick is positive in the vaccine case. Okay, let's look at some MCQs pointers. So in the MCQ, you will see in the case scenario three tests mainly: HBS, anti-HBS, anti-HBC. By looking at these three tests, you can define what is the phase of the infection. Okay, so look at this if it's all negative. So try to answer it. So all negative, it's susceptible. You know better. Okay, here is the trick. If anti-HBS is positive, mean what? Anti-sick, anti-sick in the vaccine case. Okay, so he is vaccinated. Anti-sick is positive and anti-HBC is positive. C and S, succor. This is going to be succor. So succor is the recovery phase, or you can say the post infection. Okay. So if HBS is positive, meaning patient is sick, infected. Which infection? IgM. IgM mean what? Acute infection, of course. Here is the HBS is positive, but the anti-HBC is IgG. So case will be chronic infection. Okay, and if they show that the HBS is positive and the anti-HBC, if only anti-HBC is mentioned, this is chronic infection. Anti-HBC only represent actually IgG. It's most of the case, so we consider it as a IgG. So this is the again the chronic infection case. Okay, so if all are negative but the anti-HBC or you can say IgM is positive, so the case will be me. Okay, me window period. Okay, this is all about the serology of hepatitis B virus. Thank you very much. Allah Hafiz.